Food security is said to exist when all people have both economic and physical access to safe, sufficient, and nutritious food that will help meet their dietary needs and preferences for an active life. To attain this, it is therefore important to understand the 4 key facets of food security, which include food availability, access, use, and food stability. Get to learn this and more in our certificate program at Humanitarian Global. Among the topics that will be covered include Introduction to Food Security and Nutrition. This module will familiarize you with food security and nutrition, nutrition problems, vulnerable groups, and causes of malnutrition in emergencies. Secondly, Nutrition Assessment. In this module, you will learn about nutrition assessment, community nutrition assessment, food security assessment, and community mobilization in emergencies. Thirdly, Food aid and livelihood support. Get to understand about livelihood support in emergencies, nutrition information systems in emergencies, food aid, humanitarian assistance and standards. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.
Who is a part of our team also, maybe to give a small introduction concerning Humanitarian Global and also tell us more about today's event. Anthony, are you there with us?
Yes, I can hear you, Eric, and thank you so much for kicking us off when it comes to this particular webinar for today. So welcome to all of our participants to this particular event. My name is Anthony Mkuhi, the Academic Registrar at Humanitarian Global. I can see from the list of participants, most of you we've been able to interact before, and thank you so much for the consistency and always ensuring that you can attend these events, and we encourage you. Feel free to share the same with your colleagues, with your social media networks, so that they can also enjoy and benefit from these sessions. So today, I just have some few items to focus on, maybe for our first-time participants, because I can also see on the list we've got new participants joining for the first time. And Humanitarian Global is the one that has been able to organize this event for you. Each and every week, we do have like 2 sessions, one on Thursday, and then on Saturday as well. We do have another session on different areas. So today, we are going to focus on food security and nutrition in emergencies. And maybe just a brief about who we are. We are a training institution that is based in Nairobi, Kenya. Our main focus is to work towards capacity building of both the humanitarian and development professionals. That is what we focus on. And in this particular institution, we do cover various areas, which include food security and nutrition in emergencies, the theme for today. We also do tackle monitoring, evaluation, accountability, and learning. That is a meal. We also do tackle water sanitation and hygiene, that is WASH, disaster risk reduction and management, that is a DRRM. We also do tackle human nutrition and dietetics. We also do tackle procurement and supply chain management. And then we also do tackle maternal, infant, and young child nutrition. So those are among the areas that we focus on when it comes to training and learning. And we would like to urge you, as the session continues, we are going to be sharing with you a link to our website so that you can get to see a comprehensive list of all the areas that we train and the programs that we have. So for today, it might be a brief session, 2 hours. It's not quite enough. You can agree with me that we can really even maybe require like a whole day plus to tackle exhaustively when it comes to the agenda for today. But what I would like to urge you, engage us, because we do have further training on the same. We do have various programs, and our facilitator for the day, she'll be taking you through some of the programs that we do offer in connection to today's topic. So feel free, and you are going to be assisted by our team so that you can enroll and pursue further training and also get a certificate for the same. With that said, I would like now to invite again Eric, who is going to welcome the facilitator for today. and then we can start off the session. So thank you so much, and keep on sharing the link with your friends, with your colleagues, so that they can also join. So back to you, Eric.
Thank you for that, Anthony. And for our next key person is our speaker for the day, who is Irene. And just before I invite Irene, I'd like to remind our participants that we do have your emails. So let's avoid posting our emails on the chat section. And also, if you have any question for today's session, that is for the food security webinar or humanitarian global, you can kindly post it on the Q&A. Let's not post it on the chat section. And at this juncture, I'd like to invite Irene Maregi. Irene, are you there with us?
Yes, I'm here.
Thank you. Maybe you can begin by introducing yourself, then you can continue with the session.
Okay. Good morning, everyone. My name is Irene Maregi. I am a nutritionist. Specifically, I'm a trained and certified clinical nutritionist. And my key areas of interest are all issues that have to do with nutrition, and that includes food security, that includes areas of food and nutrition assessment, and also areas of maternal, infant, young child nutrition. I am a trainer here at Humanitarian Global. I facilitate some of the courses that are aimed at training in areas of food security, maternal nutrition, and also human nutrition. So I welcome you to our session today. It's a brief session, but it is packed with information, a lot of information that I hope at the end of the day will have added to your knowledge about one thing or another. I welcome you to this session, and I also want to invite you to feel free to send in your questions in the Q&A as we go along, because we will have an open session where we will have a discussion and I will get to address some of those concerns. So at any moment, because you might not be able to interrupt me while doing the presentation, just send in your questions and we will get to that. And so because of time, I'm just going to get right into it. So our topic today is how to carry out a food security assessment. So in areas of food security, one of the things you need to find out in any situation before you can even come up with an intervention is to assess if the community or the people you want to work with are food secure. And one of the ways to do that is to carry out a food security assessment. So we are going to look at what food security is, how to carry out a community food assessment, and also how to carry out a community nutrition assessment. And these will be key, especially if you're in the planning stages of coming up with an intervention in an area where there is food insecurity, or even if you are carrying out the performance of previous projects. So what is food security? So food security means access by all people at all times to enough food for an active, healthy life. So when we say that people are food secure, we mean that these people all the time have enough food to live an active, healthy life. That means they get all their meals, they get a variety of food, they get enough food for them to grow, for them to be healthy, for them to have a good immunity, and also to be active. It includes at a minimum, one, the ready availability of nutritionally adequate and safe foods. And two, an assured ability to acquire acceptable foods in a socially acceptable way. Not just the presence of food, but you ask yourself, do these people have access to nutritionally adequate foods, that is foods that meet their daily nutritional needs? And are these foods safe? They are not expired, they do not have things like aflatoxins, that these foods are safe. And number two, are they able to acquire these foods in socially acceptable ways? That means, can they afford this food? Can they be able to move from their home to the marketplace without any security issues? So things like those. Food insecurity, therefore, is limited or uncertain availability of nutritionally adequate and safe foods, or limited or uncertain ability to acquire acceptable foods in socially acceptable ways. So the opposite of food security, if the people are not able, or they are not, or they have a limited ability to get food, or they are not able to acquire this food, either because they do not have the economic resources or because of other challenges, then they are food insecure. Hunger is the uneasy or painful sensation caused by a lack of food. And it's also the recurrent and involuntary lack of access to food. So a result of lack of food, or a result of food insecurity, is hunger, first of all. Community food security is a relatively new concept, and there's no universally accepted definition. But for some purposes, food security in the community can be viewed as an expansion of the concept of household food security. So when we're talking about community food security, we are asking ourselves, if all the households in that community are food secure, do they all have access and availability of food? As household food security is concerned with the ability to acquire food at the household level, community food security concerns the underlying social, economic, and institutional factors within a community that affect the quantity and quality of available food and its affordability or price relative to the sufficiency of financial resources available to acquire it. So at the community level, we are also looking at the social issues, economic issues, or the institutional issues that may be affecting the community as a whole and that have an impact on their ability to afford food. So are there economic issues that are going on that are affecting the prices of the food in a community? Or do we have infrastructure challenges that as a community are going to have an impact on food security? Community considered to be food insecure if there are inadequate resources from which people can purchase foods. The available food purchasing resources are not accessible to all community members. The food available through the resources is not sufficient, excuse me, is not sufficient in quantity or variety. The food available is not competitively priced and thus is not affordable to all households. There is inadequate food assistance resources to help low-income people purchase foods at retail markets. There are no local food production resources. Locally produced food is not available to community members. That is, there is no support for local food production resources. Then there is significant household food insecurity within the community. So all of these are things you look at the community level to see if a community is food insecure. A community assessment helps community members to address their needs by using their own resources in a systematic way to identify resources, needs, and specific challenges or problems. The word community is key to the process. It is a process led and implemented by community members to achieve a community goal. Typically, the community will gain not only from the information collected, but also from the assessment process. So when you're carrying out a community food security assessment, the main thing you need to take into consideration is that the community is at the center of your assessment. So you need to involve the community during the process. And the end goal of a community food assessment is to help the community use their own resources to address challenges. So it is very community-centered. By integrating people from different parts of the community into the team and developing a joint agenda and a resulting action plans, the community's bonds are tightened. So you should integrate people from all social classes of the community. You should include people from all geographical areas in that community, so that at the end of the day, everybody benefits, and also it becomes something that the community owns, and something that also increases community togetherness or unity. The goal of the assessment is to collect information to identify gaps and needs in the community, and the resources, services, and systems that could be used to fill the gaps and meet the needs of the residents. To accomplish this, you will get information that helps you understand the following. 1, status of community residents. 2, availability of the community resources. And 3, capacity of community resources. So with that being said, now we take it down to see what a community food security assessment is all about. So a community food security assessment is a unique type of community assessment, and it includes the collection of various types of data to provide answers to questions about the ability of existing community resources to provide sufficient and nutritionally sound amounts of culturally acceptable foods to households in the community. So when you're carrying out a food security assessment at the community levels, you want to see if the entire community has sufficient amounts of food, if the food that they have to provides all the required nutrients in all the correct amounts, if the foods are culturally acceptable also to all the households in the community, and if all the household levels of all economic levels can afford to get this food. The result of the assessment is the generation of a community profile that may highlight the negative and positive components of the community's efforts to satisfy households' food needs. According to the Community Food Security Coalition, components of CFS, or Community Food Security Needs Assessment, includes information on access to food, levels of hunger, nutrition, and local agricultural data, an inventory of community food resources, and policy perspectives. So it has a lot of information that you need to look at. These components can include factors such as 1, effectiveness of local infrastructure for delivering federal food assistance programs. So you need to look at the local infrastructure and see if there is a food assistance program that is running in the area. Does the infrastructure support that? Then adequacy of supermarkets or markets, barriers to food shopping, modes of transportation, selection and price, and the local markets, income levels and number of persons in poverty, that is use of emergency food system and federal food assistance programs. So you also need to see how many people are in poverty, how many people rely on emergency food systems, and if there are government food assistance programs, and how many people are enrolled. Then you also need to look at the loss of farmland, farm startups, use of sustainable production methods, and availability of locally grown food in local stores. So because food in some communities is grown within the community, if there is loss of farmland, for example, to commercial farming, farming of cash crops, if there's loss of farmland where there are industries that have come up and therefore land is no longer usable for farming, or if there are farm startups where the community is trying to come up with sustainable farming methods, if their production methods are affordable and sustainable, and if the community has the ability to grow its own local food, is also a factor we need to consider. We also need to consider the number of community gardens, home gardens, farmers markets, community supported agriculture programs, food crops or other alternative food production or distribution arrangements, and space available for food production. So in some communities, you find that there are programs that encourage things like community gardens, where there is a community land or there is a farm space where the community comes together and grows things like vegetables or some subsistence food crops that benefit the entire community. So you need to look at if there is a program like that, if people have home gardens. So even if it's a community in an urban area that you're looking at, there are people who have small home gardens behind their homes, or in areas where farming land is an issue, you find people coming up with small home gardens. If there are farmers markets, or if there is even food crops or alternative production or distribution systems in place. And then you also look at the scope of food policies affecting the community and evidence of integration of food-related issues into the local planning process. So you also have to look at the policies in the community, the agricultural food policies, the economic policies, and if all these policies have taken into consideration food-related issues. For example, do the policies affect the prices of farm inputs like fertilizers or seeds? Do the policies affect issues like the inflation of prices and the effect of having middlemen between the farmer and the market, where the farmer is not getting value for the crops, but the food crop is being sold in the market at an inflated price because of cartels and middlemen? So you need to also look at all the policies that might be affecting availability. The key to community food security assessment is that it integrates information from a variety of sources about food security issues in a community. In an ideal assessment, information about individual components of community food security would be coordinated into a comprehensive picture of the food security situation in a community for local decision makers. A community food assessment will help you to, 1, understand the local food systems, 2, inform the setting of goals to improve these local food systems, 3, inform decision-making about policies and actions to improve community food security, and 4, establish a long-term monitoring system with a clear set of indicators. So this is why we do a community food assessment. You will understand the local food, understand if there is availability of food at the community level. You will understand if the community relies more on their own food that they produce, or they rely more on buying food from markets. Then you can be able then to set goals where you can improve these local systems so that the community can make better use of their own resources and can become more food insecure. You can also use the data that you get from a food security assessment to help decision makers make better policies that will enable the community become more food insecure. It will also help you come up with a good monitoring system, or even give you a baseline for where to start if you're going to establish a food security project. The purpose of community food security assessment is to facilitate decision-making about programs and policies that affect food security in your community, and not just to collect data. The process of data collection can be costly and time-intensive, and needs to be based on a plan that focuses on the efficient use of personnel and other resources, and should be driven by a clear conception of how the information will be used. So even before you come up with ways on how to collect the information, you need to understand what you want to do with the information, because that will also tell you how to best distribute your resources. Therefore, before embarking on data collection, it's important to identify key questions to determine the types of information and analysis needed to answer those questions, and to identify potential users of your findings. So the key goal of carrying out a community food security assessment is for us to be able to understand the situation so that we can come up with solutions to challenges. You may want to answer the following potential key questions. One, what are the geographic boundaries of the community that you're planning to study? So you have to define the community in terms of the geographical area. So the area that you're going to cover, you might decide that it's going to cover maybe a district, a division, or a province. So you have to define the geographic boundaries. Is household food insecurity a problem within the community, and who is at highest risk? So you also have to identify food insecure households and also identify the most vulnerable groups. How many people use food assistance programs? You also have to answer that question. Also, does the community have the necessary infrastructure to effectively deliver food assistance programs at the local level? So you also have to look at the infrastructure, because if you want to establish a food security intervention, maybe you want to start distributing food aid, you have to see and understand if there is enough infrastructure to support that. Do all people in the community have reasonable access to retail food outlets? So you also have to look at this. If the community has access to retail food outlets or even markets, because in some areas you find that the people are isolated and they are cut off from markets where they have to walk 15, even 30 kilometers to get to the market. So even if there is food in the market, there are people who cannot access it because it is too far away. You also have to ask yourself, are there sufficient resources available to meet the needs of people who need emergency or supplemental food? So do you also have resources in the community to be able to help the food insecure people, or the people who now the food insecurity has reached a level where it's an emergency and you need to come up with therapeutic or supplemental feeding programs? What types of agricultural resources exist in the community? This is key because it will help you identify the resources that are being underutilized and the resources that you can teach the community the importance of and how to use to address their own challenges. Locally grown food communities, retail food stores or food service outlets. So also, if the community grows its own food, is it enough food that it is there is surplus to be sold in the market, or do the farmers farm just enough for their own needs? And then also you need to see, are there local policies and ordinances that affect the community's food security? So you also have to look at things like trade agreements, the economic policies in an area, the agricultural policies. You have to look at all of that and see if they're affecting or playing a role in food insecurity. To help answer these and other questions that may be unique to your community, and to plan a timely and cost-effective community food security assessment, it will be necessary to form a diverse team of community members to plan and oversee the assessment activities. So we have looked at what a community food security assessment is, and now we are going to look at the steps to carry out that assessment. Now, remember in our introduction, I said that a community assessment of any kind is really centered and the key participants in a community assessment is the community themselves. So you need to come up with a good representation of community members that will be part of your assessment team. So before deciding exactly what data you should gather, it's important to know something about the types of data that can help describe the food security situation in your community, sources of their data, of that data, and their availability. It's also important to know the core components that underlie a community food security assessment. So a comprehensive community security assessment has 6 basic components. So one, you need a profile of the community's socioeconomic and demographic characteristics. So you need to be able to understand and explain the socioeconomic and the demographic characteristics of your community. 2, a profile of community food resources. So your assessment needs to answer that. 3, the assessment of household food security. So even if you the assessment is at a community level, you also need to understand the household food security in that community. Then assessment of food resource accessibility, assessment of food availability and affordability, and assessment of community food production. So these 6 basic components are really critical and must be in your community food security assessment. After meeting with your assessment team to set goals for the assessment and gathering input from key informants in the community, you might decide that a comprehensive assessment is unnecessary or too expensive, and find that you want to focus your efforts on one or more, but not all of these components. So with that being said, even if we are saying these 6 basic components are what informs a comprehensive community food security assessment, sometimes because of the restriction or the challenges of not having enough resources or time, then you might decide that you cannot be able to cover all the 6 components, but you can focus on 1 or 2 depending on what your objective or your goal is. So you can also choose, for example, to assess resource accessibility, availability, and affordability only. So your community food security assessment can also just be centered or focused on 1, 2, or 3 of these components. So we look at the team members. One of the features that distinguishes a community food security assessment from other research done on a community is that it is envisioned, planned, conducted, and used by people living and working in the community. Diverse representation in the planning process is key to a successful outcome. The involvement of individuals from different parts of the community may increase access to data. For example, a representative from the local food storage facility may have unique knowledge of and access to data on emergency food use in the community. Once involved in the planning phase, people will be more likely to involve their constituencies in the process itself, and also will better understand and use the results to inform policies and programs related to community food security issues. A diverse team of 8 to 12 people is ideal for planning and implementation and implementing a comprehensive community food security assessment. So we're saying that the data that we are collecting when we carry out a community food security assessment is supposed to be collected and used by people who work and live in that community. So even if you are not part of the community, you should ensure that you involve key people in the community from the planning stages of your assessment. So the people you involve will increase access to data because they know more about what happens in the community than you might do, an outsider. And also involving these people early on will help them feel more confident about the process, and they are going to actively participate in collection of the data and also in the use of this data. Ideally, the team should consist of professionals and others in the community who have a common interest in community food security and who have different areas of expertise. The team also should include community residents who have direct experience with food security issues. Here are some examples of people to recruit for your assessment team. So you can have local government representatives from community-based organizations, that includes religious organizations, emergency food providers, social or neighborhood groups, health, education, and nutrition providers, retailers and manufacturers, community residents, and the farmers. So these are some of the people that you can include in your assessment team. Also, it is helpful to have members who are people with strong leadership and planning skills. These are people who will help you mobilize the people you need. They are people who will help you network and be able to get information. And also local research resources are familiar with data collection and analysis. So you can also use local universities, local businesses, or other NGOs or nonprofits that are involved in the community and have also carried out assessment activities in the community. And also people with good oral and written communication skills, because when you're collecting data, you need people who can get other people to open up. If you're going to carry out use or you're going to carry out things like questionnaires, then you need people who have good communication skills. When recruiting potential team members, be prepared to describe these factors. One, the importance of the assessment to the community and its members. So because your team has a very large number of community members, you should be able to convince your team members why this assessment is important, not just to you, but to the community at large. How each member can contribute to the process regardless of his or her research skills or food security knowledge. This is important because some of the people that you will include in your team might not have participated in any other kind of assessment. So they need to be convinced that their contribution is important. Regardless of their lack of knowledge on how to carry out a research or carry out an assessment, that the knowledge they have about the community and about food security in the community is appreciated and is critical. Also, what the planning team will be doing to conduct the assessment and the time commitment involved. So you need to tell them upfront what activities are going to be undertaken, their level of involvement, and how much time and also resources they need to put in while carrying out the assessment, and also how the results could be used throughout the community. So you need to convince the team members or the representatives from the community of all this so that you can be on the same page. So now that you have your team, we move on to finding and using data. So how are you going to collect data and what type of data are you going to collect? So there are two basic types of data: existing data and original data, or what we call secondary data and primary data. So existing data or secondary data is data that has already been collected. It may either be compiled or uncompiled. So examples of compiled existing data include county level poverty numbers published by the government census bureaus. Also, community agencies or NGOs often collect numerous pieces of information that may not be aggregated and summarized, and this is known as existing and compiled data. So you may find that there is data on things like household poverty levels or the number of people who are beneficiaries of emergency food programs, but this data has not been compiled. Means that when you get that data, you will have to go through it, assess it, and analyze it so that it can make sense for your individual situation. Examples of existing and compiled data may include the number of households served by a local CBO or the number of emergency food providers in the community. So also uncompiled data may just be data in general. And then the original data, or the second type of data, after your review of the available existing data, you may find that no appropriate existing data are available to answer some of the questions you want answered. And in this case, you have to collect new or original data. And this is also what is called primary data. So sources or examples of original data include data from community, evidence on household food security, data from farmers about their participation in farmers markets, data on types and quantities of food distributed by NGOs, and data on the price and availability of food items from markets or other food stores. So when you're carrying out an assessment and you look for data and you do not find sufficient data that has already been collected, or the existing or secondary data, then you will have to collect original or primary data. Also, you might need to collect primary data to also add on to the secondary data, because secondary data might not be current or might not have been focused on your specific objective or the specific community that you're in. So you ideally should use both secondary and primary data, where you look at data that had already been collected, and also you can collect your own data so that you have a more comprehensive result. Next, we look at various data collection techniques, or how you're going to collect these original data. So we have several methods. We have surveys, observations, and focus groups. So surveys and observations, surveys are used to gather information consistently and accurately from large numbers of people. One key element in conducting a survey is to ensure the representativeness of the community. So a survey is used when you want data from a group of people. It is a predetermined set of questions or indicators that are collected either by interview, written personal responses, or observation. So when you're carrying out a survey, you can interview people one-on-one. You can give them questionnaires and the people fill out personal responses, or you can just observe, use your own observation and come up with data. The responses might be closed-ended or open-ended. Closed-ended questions include multiple choice questions or scales used for ranking priorities or preferences. Open-ended questions provide space for the respondent or observer to answer the question freely without any cues or categories. So when you're asking questions in surveys or you're making observations, you can choose to ask closed-ended questions where you give people answers to choose from. Or they tell you it's either a yes or no question, or a true or false, or things like those. But an open-ended question might be better, because it means that you give the respondent enough space or you give them the opportunity to express themselves without any prior limitations. Surveys can be used to collect data through observation. One example is the observation of users of a particular resource or program, and noting facts such as their gender, ethnic or racial characteristics, and time of use. So you can also collect data from a large number of people just by observing. So you can send observers or people who will make their own judgment. They will not really interview people or talk to people, but they might go to the market and make an observation of, for example, the variety of vegetables that are available. Without asking other people, you just make an observation and you note it down. Or you look at the number of people who are involved in food emergency programs, and you make an observation that the program has more children than adults, so the program is targeting more women than men. So observations tend to be a bit subjective. Observation is conducted using an observation guide or survey instrument. The guide or instrument provides space for recording information accurately and consistently, and serves to ensure that all information is captured in the required format. Although observation does not require direct interaction, it is important to request permission from the resource or program at which the observation will occur. So even if we've said that one of the differences between a survey and an observation is that an observation does not involve asking questions. You make your own observations independently. The people you're observing should give consent. So you do not just show up, for example, in a program and or at a feeding site and start making observations without informing anyone or getting consent. So you also need to get consent from those people. In addition, observers should be discreet and as invisible as possible, so as not to interfere with normal resource activity or to bias the activities being recorded. So with that being said, we need consent because of the ethical side of data collection. You need consent from these people to observe them, but try and not get in their way. Do not interfere with their activities. Be as discreet or as invisible as possible, so that one, they do not feel uncomfortable, and two, they do not feel as if they are being recorded and therefore start behaving in a way that they are not used to. And then we also have focus groups as a way to collect data. So focus groups are a data collection method used for studying areas in a group context. Unlike surveys in which the researcher asks a question and the respondent answers, focus group techniques rely on interaction within the group based on topics supplied by the researcher. The people invited to participate in a group should be selected with care, and for best results, it's recommended that the group should be limited to between 8 and 12 people. Focus group participants should always have some connection with the topic being discussed and should be a relatively homogeneous group. For example, if the discussion will revolve around farmers' use and experience with local farmers' markets, most of the participants should be farmers who have the opportunity to participate in these efforts. However, it may also be useful to include farmers who have the opportunity to participate but choose not to do so. So unlike the surveys and the observations, focus groups is more like getting or selecting a number of people who have information about a certain topic or question that you have. And then you gather these people together and then you give them a topic. And then giving them the topic, then they discuss about that topic. They share their experiences, they share their challenges, they share their opinions within that group. So therefore, that means that the people you select in that group should be people who can have, first of all, prior information about that topic and should have key information. So for example, if you want to get information on farmers markets, then it only makes sense that you include farmers. If you want information about things like crop production, then you involve the people who are involved in that. If, for example, you want to look at the distribution of food in the household, then it might make more sense to include women who are often left with the responsibility of preparing the food and distributing the food within the household. Since it's also important that participants be representative of the various subgroups within the targeted population, it's common to conduct a set of focus groups with different segments or subgroups of the targeted population. For example, if a focus group were to be conducted on residents' experiences with food security, groups might be separated by household type, that is, households without children, households with children, households with elderly members. Within each group would be people representing the different ethnic or racial groups living in the community. If the community is spread over a large geographic area, different groups might be conducted with participants in different community locations. This diversity will ensure that the information collected in the focus groups will represent the diversity within the targeted populations. So we are saying here that focus groups should also be representative of the target community. So within the focus group, you might find that there are subgroups. For example, in our example here, if you're looking at different households, you find in a community that there are many other households within the community. There are households with children, without children, with elderly members, with one income, with multiple incomes. So it's also important to look at the subgroups within the focus groups. Also, if your assessment is covering a large geographical area, ensure that there is from all areas in that community. Screeners can be used to help with the selection process. A screener is a set of questions that categorize the population groups you wish to include in your focus group. For example, if the group is to include people from a mix of ethnic groups and income levels, and only those who participate in food assistance programs, you might ask people about their ethnic or racial identity, income, and participation in food assistance programs. A screener is typically very short and also is used to provide the potential participant with information about the purpose of the focus groups. They are conducted by a facilitator using a focus group guide. And a focus group guide typically includes questions that are open-ended and will provoke discussion among the participants. There is never a right or answer in a focus group, and all participants are encouraged to recount their experiences or to present their points of view without criticism or comment from the group. So when you're selecting the people to participate in these focus groups, you can use a screener to help you with the selection process. So these are just a simple set of a few questions that will help you identify the category of people who will participate. Also, you need a facilitator in that focus group, and the facilitator is supposed to basically ensure that the discussion goes on in a good way, and you ask open-ended questions because you want it to be a discussion where everybody feels free to give their opinion and be able to be heard. In addition to the facilitator, a person should observe the group taking notes and should also tape record the discussion. And of course, this is after consent from the focus group members. The role of the recorder includes observing the dynamics of the group and the unspoken expressions displayed by the participants. Sometimes focus groups incorporate a short written survey, and this survey can be used in the beginning to slowly introduce the topic of interest while also collecting specific personal level information. So in addition to having a facilitator who will lead the discussion, you can also have an observer. So because we know that communication is diverse, and it's not just about say, it's also about the body language, the facial expressions, and also the interaction of people within the group. So if you could have someone also observing the group to take extra notes, and also you can include a survey within the focus group. So those are the main ways that we can use to collect data, but you need to find and train some data collectors. So ideally, you should have several people available to collect this data. The actual decision on how many to assign to this task will depend on your resources, previous experience of your team members, and members' desire and ability to collect data. Once you have determined how many people are available for data collection tasks, you want to determine which staff members are best suited to the collection of existing data and which are suited to the collection of original data, each of which places unique requirements on the data collector. So remember, we said we have existing data and we have original data. So when you're training data collectors, you need to carefully assess and select who is better suited to collect original data. Maybe you may want people who understand the local language or the local dialect. You may want people who have very good leadership and personal skills, people skills, collecting original data, because they may get the community members to open up better. While you may choose to select people with previous experience of analyzing data to collect the secondary data, which just needs a different skill set. So that also is a key factor that you need to consider, because the people you choose to collect this data might determine the quality and quantity of data that you get at the end of your assessment. Each person selected to collect data must receive training before the task. The training should be of sufficient length to prepare the individual for his or her role in the assessment and to ensure the individual's level of comfort. It's difficult to quantify the time required for training because of the differences in individuals' past experience with data collection, education levels, and attitudes towards the importance and sanctity of research. So after you find your data collectors, because you will include a lot of members from the community, you should be able to train them or take them through what is required of them, how to go about it, things like the considerations when collecting data, so that you can get quality data and so that you do not have issues down the line about how data was collected. Then that is about collecting data. And then now we begin the data collection process. So how do you select respondents? So sampling is a technique that is commonly used in social science research before the collection of data, and it allows the researcher to save time and money by limiting the number of programs or participants who must be interviewed or observed during data collection. This does not mean that you're allowed to pick and choose among available participants to arrive at a workable number. Rather, when drawing a sample, you will follow a series of steps to select a sufficient number of potential respondents to represent all available respondents. Therefore, your sample will be a representative sample of the available population, allowing you to draw conclusions that may be extended to the entire community. So what we are saying is, when you want to carry out a community assessment, then the community has a lot of people. You may have a community with a population of even over 100,000 people. Now, you cannot be able realistically to interview or collect information from over 100,000 people, and you might just have a week or 2 weeks to collect your data. So what you need to do is what we are calling sampling. That means you select a few people from the community, but you select them in such a way and using a process where you're sure that these people are a true representation of the community, that the information you will get from them reflects to a very large degree the situation in the community. The strategy of selecting a representative sample and devoting resources to obtaining data from as many respondents in that sample as possible produces results that are superior to a half-hearted attempt to include everyone. So sampling is important because if you try and include everybody in the community, you will overstretch your resources, you might not have the time, and data collected might not be of a high quality. So you're better off selecting a representative number of people and collecting quality data than trying to include everybody, which might not be possible. In other words, a 75% response, a random sample of 100 is better than 25% response from a population of 1,000. There are several ways to create a sample. So in the largest studies, like those conducted at a national level, researchers might rely on special computer software to randomly select people or to choose people with specific characteristics that are representative of the population. In smaller studies, you can consult a table of random numbers. So you can go about it in any way. There are different types of sampling techniques, which we might not be able to get into right now because of time, but you can either choose random selection methods where you choose participants randomly, or you can choose targeted sampling where you choose specific people because of specific characteristics. But the key point of selecting a sample is to ensure that you get a true representation of the community. And then after we collect data, there is analysis and interpretation. So once the data are collected, they will be analyzed and used to develop a general picture of community food security. This section represents an overall discussion of the types of analytic approaches that can be used within a community food security assessment. And the analytic approach used will reflect the purpose of the assessment. For example, if the goal is to understand how the community compares with the nation, the analysis will focus on comparisons with national standards. If the key is to develop an action plan, the analysis and presentation will be community specific and will use graphic displays. If the purpose, for example, is to develop a baseline of information, spreadsheet compilation may be all that is required. And the analysis will be both quantitative and qualitative. So what we are saying is your analysis of the data you collect will depend on your purpose of the assessment. So what was your objective? If, for example, in our first example, you wanted to understand and compare how food secure the community is in comparison with the entire country, then your analysis will focus on comparisons where you will be comparing the availability of food in the community versus the availability of food in the nation. So that is one example. If, for example, you wanted to come up with a plan or you wanted to come up with interventions, then your analysis is going to be community specific, and you're going to really focus on what is happening in the community, the resources that you have, and what you can come up with as a solution in the community. If you wanted baseline information, that means that you just wanted information where you can be going where you can use as a referral point for in the future, maybe when you carry out a project, you will have a baseline to refer to see if you're having the desired impact. Then you might just need a spreadsheet compilation. The quantitative analysis will focus on measuring specific profiles of community characteristics, whereas the qualitative will be used to describe some of the community dynamics. Qualitative analysis will use information collected through focus groups and other interviews, presenting the results of a community assessment to parties involved in the assessment process. Key policymakers and the public is an integral part of the process. And given the variety of audiences interested in the results, the presentation should be easy to understand. Therefore, graphic displays, maps, and tables should be used to present the data whenever possible. So the data that you're going to collect is something that you need to share. First of all, with the community, because you involved them when you are collecting the data, and it's the community that should benefit the most from the information that you get. So because you're going to share this information with various groups of people, the community, you're going to share it with the policymakers or representatives in the community, political, religious, even other NGOs, even the public in general should have access to the results of your community. It means, therefore, that your results should be produced in a way that is easy to read and understand. And that means that if you can use a table, which at first glance, a lot of people will be able to see and understand. If you can use a graph, if you can draw a map to explain, if you can use visual aids to present your data, then that is really going to be helpful. So once a statistical profile is complete, the data can be presented in different formats, and the formats you choose should reflect the intended purpose of the presentation. So for example, you should use a bar graph to show comparisons of the number of people in each age group. So the visual aids you use should also be very easily interpretable. If you're comparing characteristics, then a bar graph is better. If you want to represent a relative proportion of different things, then a pie chart might be easier. So your analysis and presentation of the data is really personalized, or is really subjective to your objectives of the community food security assessment, and also to your audience. So that is all about the community food security assessment. And we've looked at how to go about it, from the people to involve, the different types of data collection methods you can use, how you're going to analyze the data, and how you're going to present that data. So the second part of a food security assessment is the community nutrition assessment. So that was on food security, where you look at the availability, accessibility, affordability, and the quality of food. Now here we are going to look at the nutrition aspect of the community. And the reason why we look at community nutrition assessment as an indicator of food security is because it's a direct result of food security in the community. So a food insecure community is likely to have a lot of malnutrition cases in the community. So when you're carrying out community nutrition assessment, you're going to use anthropometric measurements, or measurements of the body proportions, and we majorly use the weight, the height, and the MUAC. So how do you assess the nutrition status of adults in a community? So for adults, we use what we call the BMI, and this includes the use of weight and the height. And then we also use MUAC together with, if we are screening for admission into supplementary or therapeutic programs. So we look at the clinical signs, or the visible signs of malnutrition. So things like visible wasting, loss of body mass, the condition of the hair, it's weak, it's brittle, it has a reddish color. The person might have edema, or they have water retention in their extremities. So those are some of the clinical signs that we use. MUAC is particularly important for pregnant mothers, as weight is greater due to the growing fetus. So during pregnancy, because of the physiological condition, we cannot really rely on the weight, because the weight that we get is not a true representation of the mother's weight. So we also rely on MUAC during pregnancy. There is no international consensus for classifying some in adults using BMI or MUAC, but we have some cutoff points or some indicators that we commonly use as guided by the World Health Organization. So if there is edema, then there is likely severe acute malnutrition. Although it is not the only indicator we use these indicators in combination. So we don't just look at one and say this person has edema, so they have severe acute malnutrition. We will look at also the BMI, we will look at the MUAC, we will look at the clinical signs and symptoms. So we use all of these factors together. We do not rely on just one. So for the BMI, if the BMI is greater than 18.5, that's a well-nourished adult. If the BMI is less than 16, then that indicates severe acute malnutrition. If the MUAC is more than 18.5 centimeters in general, then that indicates that the individual is well nourished. But for severe malnutrition, if the MUAC together with clinical signs is less than 16 centimeters, that might be an indicator of severe acute malnutrition. So the prevalence of malnutrition is used to identify groups and geographical areas at risk. The indices commonly calculated for children are weight for height or length in children under 24 months or under 85 centimeters in height. Then we also have MUAC, and we also have edema. So in children, we will assess the weight, we will assess the height or the length, we will assess the MUAC, and also we look for edema and other clinical signs and symptoms of malnutrition. In emergency situations, acute malnutrition or wasting in children 6 to 59 months is frequently measured, as it reflects recent changes in dietary intake and infection, and acts as a proxy for the nutritional status of the entire population. So the assessment of the nutrition in children, especially children between 6 months and under the age of 5, is key, because in emergency situations or in a situation where we are pressed for time and we need to have a representative picture or indication of the food security status or the nutrition status in a community, then we assess these children and we use it as a proxy, or we use it as an image of what is happening in the community. And this is because children under the age of 5 are among the vulnerable groups in the society. And therefore, any slight change that is recent in the intake of food in the community is likely to be reflected in the nutrition status of these children. So weight for height, this uses the weight of a child and compares it to the height of a standard child of the same height and sex using exceptionally accepted reference values. This measures wasting or acute malnutrition and indicates current inadequate dietary intake. And this because body weight is sensitive to rapid changes in food supply or disease, while height changes very slowly over a long period of time. This is the most useful tool for screening and targeting vulnerable groups and is widely used for nutrition surveys as a selection criteria for feeding programs. So the weight for height is used where we measure the height or the length of a child, measure their weight, and then depending on their gender, their sex, female or male, then we use a comparative chart or the weight for height z-scores to see if the child is within the normal weight ranges. Then we have the mid-upper arm circumference. This is the measurement around the middle of the upper arm, and they are a good predictor of immediate risk of death. And it's commonly used to screen individuals for admission to feeding programs, but you can also use it as a single measurement in anthropometric surveys. And it is very commonly used because it is very easy and quick to do, and you can carry it out in a quick way. You can screen a lot of children work within a short period of time. Then we have edema. It is an abnormal accumulation of fluid in the intercellular tissue and is a key clinical feature of severe acute malnutrition, and is also associated with high mortality rates in children. It tends to increase the weight of a child and hides the true picture of the child's nutrition status, and therefore all cases of edema should be separated from all other measurements and treated as severe acute malnutrition. It is a clinical sign of SAM and should be used as a major inclusion criteria to a therapeutic feeding program. Cutoff points used to classify the severity of malnutrition are either represented as z-scores or standard deviation scores, or as a percentage of the median. Global acute malnutrition in a community refers to the total, moderate, and severe acute malnutrition cases. So where you see that, for example, in some survey reports, you will not really find them using the terms moderate acute malnutrition or severe acute malnutrition. If you see global acute malnutrition, it's just referring to the total number of, or the total percentage of both moderate and severe acute malnutrition cases. Severe acute malnutrition is acute malnutrition where weight for height standard deviation or z-scores is less than -3. And this tabulation is just a summary of the things we are looking for. So in children, if there is edema, it indicates severe acute malnutrition. So weight for height, which indicates wasting. If the child has a -3 or less standard deviation, they have severe malnutrition. If they are between -2 and -3, they have moderate malnutrition. Height for age or stunting. Now, stunting is an indicator of chronic malnutrition or malnutrition as a result of lack of nutrients over a long period of time. So also the same case, if the indicator shows that they are at -3 or less than -3 SD, then they have severe malnutrition. Then we have weight for age, which indicates if the child is underweight. So also if the SD is -3 or less, it indicates underweight. Then we have MUAC. If MUAC is below 11 centimeters for children, that child has severe malnutrition. If it's more than 13.5, then the child is well-nourished. Then we also have dietary intake assessments. So in addition to the anthropometric measurements, we also have dietary intake assessments. So the amount of food one consumes will directly influence their nutrition status, and inadequate food intake in respect to recommended intake will lead to undernutrition, and it is mainly due to lack of food, poor food combinations, unbalanced diet, or somebody is eating less than they need to meet their needs. Then the different methods that we use to assess dietary intake are diet history. So you take the diet history of an individual, you ask about their food intake over several weeks. You collect information on cultural aspects of food consumption. You also get descriptions of the food that they consumed in terms of how frequently they consumed these foods, and also the portion sizes. And then you have food frequency. In this method, you obtain qualitative and descriptive information about varieties of food consumed. So here you have a set of all foods and a set of frequency of consumption, and the interviewee or the person you're assessing indicates how many times they ate a certain food from a particular food group in a week or in a month or in a day. Before carrying out the study, therefore, you need to do a preliminary survey to determine the foods that are available in that area. So when you're carrying out or when you're using food frequency questionnaires, you need to determine the foods that are available in that area, the foods that these people normally consume, so that the list that you present to the person is of foods that is part of their diet. Then you also have the 24-hour recall. So in this method, the amount of nutrients consumed by an individual for the last 24 hours is determined. The purpose of a 24-hour recall is to establish if intake of nutrients was adequate. And you ask the respondent to remember details of the type and quantity of foods they consumed in the previous 24 hours. So here is where you ask somebody in the last 24 hours, everything that they had, what did they take for breakfast, to describe the food in terms of the ingredients, the quantity, and also the frequency. So you get to see in 24 hours all the types of food consumed, quantity of food consumed, and also how many meals the person had. Then you have estimated food records. And in this method, you ask the respondent to record all the foods and beverages consumed at all the times during meal times. So the respondent should give a detailed description of the food, that is amount consumed and ingredients used. So here you tell the respondent to keep a record. Every time they take a food or a beverage, then they write it down or they record it, and they record in terms of the time they took the food, the quantity of food, and what was in the food. We also carry out indirect assessment of nutrition in a community. So it involves the estimation of nutrient intakes at a population and extrapolating from this the risk of deficiency and the likely prevalence of micronutrient deficiency disease. It involves 2 stages. First, measuring or estimating the dietary intake of the population, and second, you compare this intake with the nutrient requirements. The nutrient intake values that are currently recommended by the WHO for emergency affected populations are called safe levels of intake. So there are different safe levels of intake for all vitamins and minerals. And this indirect assessment is usually used when you do not have the resources, whether personnel resources, financial resources, or even the time to carry out individual assessment to determine the intake of nutrients at a personal level. So the indirect assessment is where, rather than interviewing individuals to find out what they're eating, you look at the food that the people are eating and you assess this food for its quality. You look at if it meets the minimum requirements in terms of the quantities of things like the vitamins and the minerals. And then you make an informed conclusion where you say that since the food that the people are consuming is deficient in vitamin A, then it is likely that the population will be deficient in vitamin A. Now, this is very useful, especially where the population largely depends on food aid or donor program, food donor programs, and you want to see if the food that is being distributed is really sufficient in terms of the micronutrients that are getting. The use of food frequency questionnaires to generate food variety and diet diversity scores can also help provide an indication of the risk of micronutrient malnutrition and trends in consumption over time. Monitoring for occurrence of micronutrient deficiencies, the possibility of excess intakes must also be considered. Excessive intake of macronutrients can be toxic, and where there are multiple micronutrient programs, e.g. food fortification, supplementation, and use of micronutrient powders at household levels, careful considerations need to be given to the possibility of excessive intakes. So also you can use food frequency questionnaires and food diet diversity scores to also make a conclusion about the quality of food and the diversity of the diet of the people that you're observing. So as well as determining the likelihood of deficiencies or micronutrient deficiencies in food, you can also use the same methods to determine if there is an excess intake of some micronutrients or macronutrients, because you may find an area where there are several programs running at the same time that are seeking to address micronutrient deficiencies. So you find that there are 3 or 4 programs that are all addressing the same issue, and you find that these interventions might cause micronutrient toxicity. So that is also something that you need to take into consideration. There is also a direct assessment. So direct assessment, you use lab tests or you use biochemical tests and you use clinical signs and symptoms to diagnose micronutrient or macronutrient deficiencies. So this is where you get samples of body components or body fluids, things like blood, urine, all that. They are taken to the lab and they are assessed for specific micronutrient markers. So you get, for example, blood samples and you test them for iron deficiency, you test them for iodine deficiency or vitamin A and such things. So this is a direct assessment, and while it is very expensive and might be challenging to undertake, it is one of the most accurate ways of determining the levels of deficiency in a population. So that brings us to the end of our presentation today of food security assessment, where we have looked at assessing food security at a community level, and then we have looked at an individual level, and at an individual level, we looked at it from the perspective of nutrition or malnutrition. And before we get into the question and answer session, I am going to take you through some of the courses that we offer here at Humanitarian Global, because as you have heard, we have covered quite a bit of information, but we have not really exhausted this area of food security assessment because of our restrictions in terms of time. But if you like to learn more, or you're interested more in this area of food security, then we offer a certificate in food security and nutrition in emergencies. And we are going to look comprehensively at nutrition problems, especially in context of emergencies and malnutrition. We are going to comprehensively also look at how to carry out community assessments, nutrition assessments, and food security assessments, and how to mobilize the community, because in most of these programs, involving the community really ensures that we come up with sustainable solutions. And then we're also going in certificate level to look at food aid and various ways of offering livelihood support. What are our humanitarian standards? What are the information systems that on during emergencies? And then the next level is the diploma. And here we are going to look at assessment and targeting. So we are going to look at how you can target your programs, how you can come up with programs that are really going to be solutions or solve the problems that the community has. And then you're going to look at how to manage malnutrition in depth, both at the community level as outpatient and also inpatient programs of malnutrition. And then we are going to look at how you come up with a nutrition intervention or a nutrition program, how you do it from the planning stages, how you carry out community education, and how you determine what you need and how you're going to implement it. And then our last module in diploma, you're going to look at community mobilization. So here we really focus on how the community is a key factor in an emergency or in food security food insecure situations, how you can also challenge the community to use the resources that are available and be part of the solution. So the certificate level or the beginner level takes a duration of 3 months and goes for a fee of $500. The diploma levels takes 6 months and will cost you $1,000. But today, if you enroll with us today, then you a 10% discount, so that you can join us and you can acquire the skills and the knowledge to equip you better as a food security personnel or even a person in the humanitarian field. So that brings me to the end of my presentation, and I'm going to invite Mr. Eric to take us through the Q&A session so that we can have a bit of a discussion.
Irene, thank you for taking us through the whole session. We really appreciate, and I hope our participants have been able to learn and be well informed. So maybe we can jump into the Q&A right before we give our participants a chance to ask questions live. And I can see a few questions from different participants. And to our participants, I still urge you to send in more questions to the Q&A. For those of you who have not sent them, or for those of you who are sending them to the chat section, kindly send them to the Q&A so that we may give a key speaker a chance to answer some of the questions that you have. Irene, maybe we can start with that.
Okay, so let us start with the questions in the Q&A. Anonymous asks, since I am the head of fish food security, I would like to ask our presenters, how could I improve this sector? I mean fish food security, and how can I develop food security system, and what steps should I follow? So this question is a bit complex, and I might not be able to cover it because this is really focused on fish food security. And for me to comprehensively answer this question, I may need more information on things such as what challenges are you going through, what is the current situation, what infrastructure do you have, what is your target audience, all of this. So Anonymous, please, the person who asked this question, we will get in touch with you, with Mr. Eric, and see how we can help you develop this food security system, because this is really personalized and contextualized to your situation, but we can certainly help you with that. We can have a further discussion after the webinar, and we can help you with that. Feisa Sefa asks, what are the methods used to conduct household food security assessment? So we can conduct a household food security using the frequency questionnaire. We can also use observations. We can also use things like dietary diversity assessment scores. So those are some of the methods that use to assess household food security assessment. So the food frequency questionnaires, the dietary diversity scores. You can also use observations at the household level. And then the Salen Yimar asks, data on food assessment can got in Kibele Agricultural Office survey on production time. Okay, I think your question has continued because that statement was a bit confusing. So you continue, data on market may give availability of food source material, but may not indicate this source may mislead. On community side, there should be power to pay, that is payability and availability of cash crops to get money to bartering. Another assessment point, on war-affected community, this is another challenge to get data since war destroyed data. I think these are comments and they're not necessarily questions, Desalen, because I do not understand if it's a question. But yes, when there is war, there's challenges getting data because as a result of the conflict, some sources of data, especially the secondary sources of data, are destroyed, and that is true. So when there is war or there is conflict, we may need to rely more on the original data or the primary sources of data, where we may need to collect data ourselves using the methods we say, like the focus groups, the questionnaires, the observations. So in cases where secondary data is not available or is not reliable, then we have to really focus on the primary data. So here where you say that data on market may and availability of food is not an indicator but may be misleading. When we were looking at some of the components of community food assessment, we said that there are 6 components. So this is just one of the components. It's not the only components. So we need to assess availability of food or data, because it is also critical. But we also had another point where we said we look at the accessibility and affordability of the food. So they are all parts of a community food assessment. So maybe that was not clear, but I gave 6 components. So yes, availability of food is one factor. Also the power to pay, or what we call accessibility and affordability, is also another factor. Feisa asks, please, can you mention some of the observation guides used in conducting an observation? So a guide that you use, or some of the key things that you're going to observe, are really going to be dependent on what your objective is. So for example, if you want to observe, for example, let me see. If you want to observe household food distribution, for example, you will come up with a guide where you will have the things that you should observe, because a guide basically just means the things that you need to observe. So you're going to look at, for example, how many meals are cooked in the household. If you're observing for household, intra-household food distribution or distribution of food in the household. So you're going to look at how the food distributed. You're going to observe on who is served first, which foods are not given to which members of the household, why this food is. So really an observation guide depends on what you're observing. I hope that is clear. So it's really subjective. And then let me see the next question. Are there any differences between PRA and, where did that question go? PRA tools and focus group discussions, so are they the same? So you're asking if there's a difference between participatory rural appraisal tools and focus groups. So they are not the same, but the focus groups can be part of PRA tools. Okay, so they are not the same because the PRA tools or the participatory rural appraisal includes participation of the community members in all groups, but focus groups just include the people who have key information on your topic. So the focus group is really specific, and the people you choose are people who are key in collecting this information. The rural appraisal or participation just includes other people, or informs that the participation should include other people. So they are not the same, but they can both be used. They are both factors to consider when you're carrying out an assessment. You also ask what is MOAC stands for. What MOAC stands for mid-upper arm circumference, which is a measure of the mid-upper arm in the less dominant hand, and it measures for muscle wasting. So it's an indicator for malnutrition. Amanya asks, how can you assess or measure the frequency of food consumption? So frequency of food consumption is measured using a food frequency questionnaire. And a food frequency questionnaire is designed in a way that you have a list of the foods that are likely to be consumed. It's like a table. So on one column, you have a list of all the foods that these people are likely to consume. And then on the subsequent columns, you have different frequencies. So if, for example, food frequency questionnaire, you want to see how many times they consume certain foods in a week, then you have the list of foods, and then the next column, you have the frequency. So you have maybe once a week, 2 to 3 times a week, every day, twice a day, things like those. So the respondent answers you. So for example, if one of the foods on the list is something like rice, so you ask, how many times do you take rice in a week? And then the respondent tells you, I eat rice twice a week, or every day, or I don't eat, a week can go by without eating rice. So you tick the frequency that matches their answer. So that is how you use a food frequency questionnaire. Teshome asks, would you tell us the importances of early warning indicators in monitoring a food security situation? So early warning indicators are basically systems that are in place that help us identify if there is likely to be food insecurity in the future. So the importance of this is that it helps us have enough time to mitigate food insecurity. So for example, if an early warning system indicates that in the next 3 months, there is likely to be an increase in the levels of food insecurity, then we come up with interventions that will prevent the occurrence of this food insecurity. So we are able to cushion the residents from the effects of the projected, or we come up with solutions to help the residents cope. So we either come up with interventions that will ensure that we cushion the people, or we start equipping these people. If, for example, it's in a pastoralist community and there is projected famine, then we can start educating these pastoralists and telling these pastoralists that because there is a projected famine, maybe you can start selling off your livestock while they're in good condition so that you do not lose them to the drought. So it's important so that we can have tools and we can be able to make decisions that will help mitigate the effect of any emergency. Can we, Abdiwasa asks, can we consider this assessment a standard one? Yes. A community food security assessment is a standard assessment that should be carried out, especially regularly, because if you're keeping watch or you're observing a situation for food insecurity, then a community food assessment is standard. Jack Peter asks, do we include persons with disabilities to be part of the food security assessment team? Absolutely. So your food security assessment team should be representative of all people. So you should represent people with special abilities, people with disabilities, people from all social classes, people from all races, if the community involves is made up of people from different races, people from different ethnic groups, if the community also includes people from different, everybody should be represented. Bayane asked, what do we mean by food resources? So food resources are either food items that we eat, or food resources are foods that are either, for example, crops that we are going to harvest, but they are crops, so they are not really food. So food resources is basically anything that will enable us to have food, something that is edible, can be eaten either ready or in the farm. You also asked, is the food security and livelihood assessment different? Yes. So the food security and livelihood assessment is different because its focus is different. So a community food security assessment just focuses the community and tries to fill in a community profile where we look at the food security of the community in terms of, is there enough food being grown? Do they have access to the market? Do they have resources that we can use to help them solve the issue? So both are assessing for food security, but they are different in terms of the objectives of the study. They look at different objectives. Tashome asks, would you define some of the major indicators needs to be monitored to understand the food security situation of an area? So we answered at the beginning of our presentation, where we said that some of the things you look at, for example, are how many people are dependent on emergency food aid or food programs. Look at the levels of poverty in the community. You look at the household food security situation. You look at the levels of malnutrition in the community. That is also another indicator. You also look at the market trends in terms of prices, if the prices are going up or they are going down. You also look at the availability of food in terms of food that is being produced by farmers in farms, availability of food in the market, and accessibility of this market. You also look at the financial ability of the people to be able to afford this food. So those are some of the indicators of food security. Fred Soma asks, many NGOs have been running programs in South Sudan for many years, but still the food security situation has not improved. What could be the reason, and how best can one do to improve food security programming in South Sudan? So this needs, for us to comprehensively answer this question, we need to do a sort of case study, because the reasons why a food security program succeeds or fails is multifaceted. It depends on the situation on the ground. It depends also on a lot of other factors. So for us to answer this, we would need to carry out a case study of the food security programs in South Sudan and try and identify the basic causes of why these food security programs are failing. But some of the reasons in general, and not specific just to South Sudan, some of the in general that a food security program can fail includes lack of community participation. So the community was not involved. It also might be a lack of proper infrastructure. It might be also poor allocation of resources, where the resources are being distributed in a way that it is not sustainable. It can also be because of political and economic instability. It can be also linked to the issues to do with agriculture and climate, such that the farming methods and the farming inputs are too expensive, or they are not sustainable, or the farming methods that are being used are also very expensive or not sustainable. So there are really very many reasons why this can be happening, but those are some of the reasons why some food security programs fail. Then we have Jack Peter asking, while carrying out food security assessment, can we also carry out community nutrition assessment at the same time? Yes, you can. You can carry them out concurrently, which might actually save you time. But you also need to be realistic in terms of looking at it from the resources you have and the burden, the response burden. So if, for example, you are carrying out a community food assessment, the same time that you're carrying out a community nutrition assessment, but then you're giving different questionnaires for both, it can become burdening to the respondents, where they can feel overwhelmed by the number of questions you're asking, or the time they are required to take. So because of some of these considerations, we carry them out at different times. But if the respondent burden is not going to be too high, you can. But because we consider the other factors other than just collecting then the data in a quick way, then we might prefer to do it differently. Anonymous asks, what methods can be used to select data collection team for security assessment in the community? By Agostino. Agostino, we say that some of the considerations that you put in place is you want your data collection team to be of people who are representative of the community, first of all. So it has to be a diverse group of people. Number two, you might want to look at their communication skills, because when you're collecting data, you're going to be talking to people, and you need people who have good interpersonal and communication skills. You might also need to include people with good managerial and leadership skills. So these are people who are going to be able to mobilize and be good at planning. You might also consider the education level of people, because some data collection methods needs some level of understanding of some technical things like how to fill out a questionnaire, the food frequency questionnaires, the questions to ask, and all that. So there are some of those methods you can use, but at the end of the day, your data collection team should be representative of members of the community, and should include people who are highly respected and people who understand the local language, understand the geography of the area as well. Rume William asks a clarification of BMI and weight for height. So BMI is a measure of the nutrition status of adults, and it stands for body mass index. The body mass index is a measure of the weight of an individual in comparison to their height in adults. So we take the height, we take the weight, and then we have a formula that we use. So the BMI is used for adults, okay? And we gave the where we said that a BMI of 18.5 kilograms per meter squared for adults indicates that that adult is healthy, but a BMI of less than 16.5 kilograms per meter squared indicates that this person has malnutrition. Now, weight for height is a nutrition indicator that indicates underweight, and it is used for children. So we use weight for height, and we use something that is referred to as, your question has disappeared. I don't know where it has gone to, but the weight for height is used in children, and here we use z-scores. So here is a comparison for, we take the height or the length of a child, we take their height, their weight, and then depending on whether they are male or female, we use the WHO weight for height charts, and we read the chart and see if the child falls in the category of -3 standard deviation z-score and below, then this child is malnourished. It has severe malnutrition. If they fall between -2 and -1 standard deviations z-score, then this child has moderate acute malnutrition. So that is the difference. Fred Soma asks, what are some Operation Blessing programs targeted at battling food insecurity? The part about Operation Blessing programs is not quite clear to me. I might need to do more research on that and then answer you. We have Feise Asefa, who asks what's difference between community food security assessment and community nutrition assessment. So the food security assessment in a community just assesses the availability, accessibility, and affordability of food. The nutrition assessment, the security assessment, assesses the nutrition status of members in the community. So one assesses if the people have food, the other assesses if the people have malnutrition. Isaac asks, what is the time interval for food security and nutrition assessment in the community? So this depends on the resources you have, and this also depends on the number of the resources you have, also on the personnel you have and the situation. So that the time you have, for example, may be shorter if you're in an emergency situation or you're pressed for time versus where you're doing a routine community food security or nutrition assessment. So the time depends on the type of research, the circumstances under which you're doing the research, and also on the resources that you have. So there's no fixed time for you to do that. Usman Angara asked, considering the sensitivity of food security and nutrition questions, how best can research scientists approach respondents? From experience, most respondents shy away from answering food and nutrition security questions. So yes, this is a challenge that we have when we are collecting data. So one of the ways that you can get the community to open up is by carrying out nutrition education and carrying out sensitization before carrying out your assessment. So this is where during the planning stages of your assessment, you educate the community on the importance of collecting this information and the benefits to the community of collecting this information. And you also tell them how you're going to use this information, because some of them, other than it being a very sensitive issue, they also do not fully comprehend the need for giving this information. But if you can explain to the people and carry out some sort of sensitization and communicate to them and help them understand that this assessment that we are carrying out is important for the following reasons. The information that we are going to get is going to help the community in the following ways. And the information or the data that we get, we are going to make it available to you for your use, so that people own the program, understand that it is for their benefit, and also if they feel that the information is for good use and purposes, they might be more willing to share. Also, you need to use data collection people who are familiar to the people. So this is where community participation comes in. So your team of data collectors should also include people who are well known in the community and people who they are familiar with, because also bringing in a lot of new faces, a lot of people that are strangers might scare the people, and they might really not be comfortable sharing the information. So another way is ensure that the data collectors are people from within the community, people that will encourage the others to open up and to share. And then finally, Feisa asks, does community food security assessment include food utilization and stability? So yes, food security assesses all the different components of food security, which includes utilization and stability. So yes, it is one of the things that you consider. And one of the ways of assessing food utilization is carrying out a community nutrition assessment. So that's where nutrition assessment comes in, because that directly answers your question on utilization. So Mr. Eric, I think we have exhausted all the questions on the Q&A. So unless there is a participant that wants to give their question or comments live, we are done with the Q&A.
Thank you for that, Maregi, for guiding us through all the questions. That is very commendable. And yes, we do have a few participants who would like to answer questions live. And to our participants, for you to get a chance, you can simply raise your hand, and from our team, we are going to give you a chance to unmute your microphone and ask your question to our facilitator today. And I can see we have Noor Ibrahim Mohammed. Noor, are you there with us? Noor Ibrahim, you may unmute your microphone. Okay, as we wait for Noor, maybe I could just repeat the instructions. If you want to get a chance to ask our facilitator for the day a question live, what you can simply do is at the bottom there, we have the raise hand option. You can click on that and I will be able to give you a chance and unmute your microphone so that you may ask a question. Just to check, Noor Ibrahim, are you there with us? Okay, maybe as we wait for Noor, we also would like to invite more questions, more comments from our participants. So you may continue to do that as we wait maybe for Noor or any other participant who would like to ask a question. I can see a hand up, Agustino. Agustino, you may unmute your microphone and ask the question. Agustino, are you there with us? You may unmute your microphone. Agustino, maybe we can check if Noor is back. Noor Ibrahim, you may unmute your microphone.
Yes, Anthony, good afternoon.
Good afternoon, Agustino. Agustino?
Yes, thank you very much on my microphone. So what I would like to ask is all about the timetable schedule for session. Is there anyone can ask for a specific presentation, or you are the one to organize for the candidates about the session that is going to be done in the week?
Agustino, kindly allow me to get back to you separately. I will respond to you on that question separately.
Thank you.
Thank you, Agustino. Rume, are you there with us? Okay, as we wait for Rume, we still encourage our participants to raise their hands and to ask questions. You can also continue to also post your questions or comments on the Q&A or the chat section. Questions, of course, on the Q&A. For the comments on the chat section, we are still here. We still have a few more minutes before we come to the conclusion. And so I will call out Rume, William, if you're there. You may ask your question. I can see your microphone is unmuted. With no further questions, I'd like to invite back Anthony to give us a closing remark before we come to the end of the presentation. Anthony, are you there with us?
Yes, I can hear you, Eric, and thank you so much to all of our participants for following up with our session today. And I believe it has been a productive one. And thank you so much for attending besides your busy schedule for the day. And we encourage you to also follow up with our website. We do have a section where you can continue interacting, and that is the humanitarian global community. So ensure that you can join, be part of it. You can post your questions there. And maybe just to mention again is that tomorrow we will be able to share the recorded version. So go to the YouTube channel via the website again, ensure that you can subscribe so that once we do the posting of the recorded version, you can be able to find it there. So with that said, thank you so much. And from us, we wish you the very best as you continue to practice and get to share the knowledge with others. We wish you the very best. In case of any question, always feel free to reach out to us. So thank you so much, and bye-bye from us now.
According to Food and Agriculture Organization of the United Nations, projections show that the world is not on track to achieve zero hunger by 2030. Additionally, majority of the indicators are also not on track to meet the global nutrition targets, with a further deterioration being projected due to socio-impacts of the COVID-19 pandemic. A solution is required to help humanitarians get knowledge and understanding of the main concepts of food nutrition and malnutrition, food security, and how they impact livelihoods to steer the world achieve zero hunger. Undertaking a diploma in food security and nutrition in emergencies prepared by Humanitarian Global ensures you get in-depth knowledge and understanding in assessment and targeting in emergencies. In the first module, participants get to learn more about targeting in emergencies, food availability, methods of nutrition assessments, and nutrition surveillance. Malnutrition in emergencies. The second module tackles malnutrition in emergencies, community-based therapeutic care, and both outpatient and inpatient management of malnutrition in emergencies. Planning nutrition interventions. Get to learn and understand more about planning a nutrition intervention, nutrition education and communication, and emergency nutrition interventions. Community mobilization in an emergency. In the last module, participants learn about community mobilization during emergencies, monitoring and evaluation in nutrition emergencies, challenges and actions to improve food security in the community. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.
86% of organizations value professionals that upskill to advance their careers. It's never too late. Enroll for a self-paced online course to begin upskilling in monitoring, evaluation, accountability, and learning. Water, sanitation and hygiene. Disaster risk reduction and management. Food security and nutrition in emergencies. Procurement and supply chain management. Human nutrition and dietetics. Maternal and infant young child nutrition. Apply today to enjoy a 10% discount.